Good morning, folks. This is John Decker, the Director of Community Services at Alta California Regional Center. Today is June 3rd, and it is 11:03 a.m., and this is Coffee with Community Services. And I'm going to turn off my email, because otherwise it's going to be very distracting. So, Kelsey, real quickly, if you can not close down your email and have the stuff from CDA up that maybe you can drop in the chat when we get there. Okay, thank you very much. Let's see, we can do some introductions. Already talking to some of our staff this morning. So we have some of our specialists on from community services this morning. So let's see here. We have Shirley, and let's see, we've got Heather, and we've got Kelsey, and Gary, Nicole, our employment specialist, Carly. My assistant, Zach, is on here. We've got some of our managers on as well. We've got Phil Perez, and who is one of our newer, well, I guess new still, a whole year, 1 month into the job, veteran as one of our residential managers down in the Sacramento office. We have our deaf and hard of hearing specialist here as well, Rima. Good morning. And we have our community services manager, Jean Onesi. We've got Christina Lane, I saw, residential manager, and Carol Wilhelm with our deaf and SLS services. And I see Scott Barr. Good morning, Scott, one of our QA specialists in community services. And if you work for Alta, and I haven't said your name yet, you have to like wave at the camera now, because I think I might. Oh, good. I don't think I missed anyone yet. Awesome. So again, Coffee with Community Services today. Let's go over your agenda items. Hey, there's Kate that is here as well. Good morning, Kate, another community services specialist. So we want to talk a little bit about rate study stuff. Gina and I just got updated by Robin, our accounting manager, on kind of where things are at with the saga that is the rate study implementation. And so we'll provide a little bit more of an update on that, and talk about new vendorizations, I think, a little bit as well. I think we're safe to talk about that too. So we will go over the Cpp Awards. We'll have Heather talk about what we awarded. We told folks last week, or the last few weeks, that we have been doing RFPs, then we did interviews, and so now we're at a point where we have to rush to get into contract with these companies by the end of our fiscal year, which is in a matter of days. So I'm going to talk a little bit about COVID stuff. New information came out yesterday. Folks are probably curious and talking about this. COVID tests, the availability of things like that. So make sure I'll talk about that. We're going to go over the Dsp surveys and talk about that. We're going to go over the Cal Savers program. I'm curious about feedback from service providers that may or may not be familiar with the Cal Savers program as well. And then we want to talk about the Hcbs validation and remediation. I know we sent the message out to you all like late Friday, I believe, regarding kind of what the plan was going to be here. And so we're going to go over some of that stuff. Cindy went over it last week with you all, but now things are kind of coming into focus a little bit more related to what your responsibilities are going to be as service providers to get this information in your free times. So that being said, we'll jump right into it by talking about the rate study. So we had rate letters that went out. Additionally, yesterday we had an email blast to all service providers letting them know that the rate letters had gone out. So what this does is this should key for you if you did not get a rate letter indicating a rate increase, and now you know that all of the rate letters have gone out, then that is when you can start, you come to that recognition that you have an issue about this. You've got that 60 days then to put that rate review questions back to the regional center, and us try to get the information from DDS specifically. So what we've discussed, and this is in, I guess this is in line with our provider advisory committee as well, is that we will host meetings for you as service providers to go over the rate study questions that you might have. We'll break it down by vendor forum group and offer some time if you want to do a little office hours or something like that to talk about these things. So we recognize that there's a time frame that's attached to that, and you might want to ask questions kind of sooner rather than later. And my recollection is that we are okay, I'll jump in the chat there and take a look at that comment as well. But my recollection is that we would be seeking out to get a PAC representative, so a representative from our provider advisory committee that would be willing to sit in on those different meetings. And so I'm going to be working. We've got, as you can see, I don't have Olivia here today. We don't have Jordan here today either. And so we are kind of covering a few things right now. We are finalizing concurrently, again, that process for the Hcbs validation, where we're also going to have to offer like office hours for you all to answer questions. And so my best guess would be early next week, we should be able to put a schedule out of when we're going to have kind of our office hour drop-in times that work best with our specialists that work with those service codes, but also we can get scheduled kind of in a timely manner so that you all have time to determine whether or not you're going to be submitting that rate review. So I want to jump over to the chat because I saw a comment there about, let's see, just an FYI, we only got one letter yesterday, still waiting today. And I know we received an increase in more than one service, so the mail is a bit iffy. Yeah, so again, we did not send them out, I believe, until it was till Tuesday when they went out. And so that being said, you may or may not have received all of your letters yet, but we did want folks to at least know that we have mailed out all of the letters for those rate increases. And if there obviously was a specific question, like, oh my gosh, maybe there was just some clerical error that occurred because I'm sure that I should have been able to get this, then please, you've got a community services specialist that you can reach out to. We have that rate questions inbox as well. I know because I just got access to it myself, so that if I feel like I want to jump in there and start answering service provider rate questions, I can. But we also, again, have our specialists that you can reach out to, and they can double check for you if needed. Gene, anything else related to that as far as the rate study stuff and with Robin? We are working on verifying the process so that new vendors are also seeing the rate increases. And so we believe we have it down, and it's just going to require us, in essence, constantly sending new rate requests to DDS so that everyone has updated rates for 2022.
I think that, yeah, John, if it's anything that we're adding, any service we're adding to a current vendor, we are also going to do what we've typically have done to set those rates, and then we'll send those over as a new to DDS as a new vendor. I mean, a new request.
So for example, if you as a service provider were going to add, like you wanted to add a transportation rate or something like that to your vendorization, or if we were going to be adding supplemental staffing to the vendorization, like those types of things. And so certainly it's just going to require a lot of kind of continued back and forth with the department, but we will certainly retro pay back to whenever the rate was, in essence, supposed to be appropriate, because again, we haven't really seen how long it's going to take us to get the rates back from DDS. It might be, a month or two, possibly. And we want to vendor programs and we want to get them up and running. So anyways, that being said, we're kind of figuring it out for some of those supplemental staffings and additional vendorizations that we're adding on to existing vendors. So, figuring out the process. Regarding the rate letters, regarding the rate review, regarding the content of the information, and we do apologize, there was a little email subject line issue yesterday, but we did send out 2 versions of the same message from Iqbal and I related to the rate study. So just, again, wanting to hear from folks about their thoughts on the, what they have, or are we all just still waiting maybe a few more days until we get all of our rate letters in the mail? Cool. silence to means it's okay that we haven't created a process that is totally unworkable for folks, and all of our service providers are unhappy with it. So that is very good. Let's move forward with this then. Let's just ensure that everyone is aware. You've got all these specialists that are here in this meeting. You know that we've got a very big, rich community services staff. Please use them to help answer your questions and things like that. And meanwhile, these guys have direct access to their managers, to me, to our accounting department, so that they're not telling you, incorrect information as well. So lots of different routes. What we don't want is a service provider who is just feeling like lost and they don't feel like who they can reach out to and contact. So again, we're hoping we can address this through holding these kind of office hour vendor meetings as well, to go over the rate study implementation. So if there's nothing further about the rate study stuff, I would like to, remind folks too, if there's things that you want to discuss and we have not put it on, or didn't bring it up in the agenda, or if you're new, you're welcome to just put things in the chat as well. And that would be certainly just fine. And we can get to your questions too. All right, Heather, you're on. Can you explain a little bit about this year's CPP stuff?
I sure can. I'll do my best. So this year we were awarded money for 3 new services, or a portion of 3 new services. So the first service is a mobile crisis response staffing unit, which we are now working toward getting into contract with Marikey Allos. The next project that we received funding for was to get online a community crisis home, and we have selected as the provider Telecare Corporation, and the HDO, or the Housing Development Organization, would be Brilliant Corners. And then the third project that we received funding for is the group home for children with special health care needs, which we're very excited about. And we are using Brilliant Corners as the housing development organization, and we are using a provider called a 5 Star Professional Group. And SB is one of the individuals who have been giving or providing services for our patients outside the area. So we're very excited, and thus far, these are the individuals that will be assisting us in our up and coming projects.
Cool. Thank you very much, Heather. We did not have a ton of projects this year, thank goodness, because it is such a very short time frame when we get our budgets from DDS at literally the very end of the fiscal year, and that requires us to convene special board meetings. It really is an impact on our regional center. That being said, we also love being able to have things like a bunch of community crisis homes and a bunch of enhanced behavioral support homes, and being able to have a group home for children with special healthcare needs, so that we don't have to send our kids far away from their families. And so I know we've had some case management folks that have joined. We have our associate client services directors. I saw Jen and Tracy both on. I saw Bailey, one of our service coordinators, on. I see Heidi that's joined us up in the Grass Valley office as well. And so again, this is a huge issue, and we want to certainly make sure that we are keeping families as intact as possible, and being able to have your loved one near you, even if you can't provide that care in your own home for them. Being able to have them close to be able to visit is really important. And so again, I appreciate Heather and the whole CPP team and the work in doing this. Heather has become kind of our medical home expert over these years in community services. And so I'm very happy to see Alta being the first regional center that is going to be looking at opening up one of these projects. I haven't heard how Central Valley Regional Center's RFP process went, but I'm very pleased to hear that we had applicants, and getting such an experienced applicant that we have a long history with, and we know for a new project like this is very important. And certainly anyone from the Sacramento area or statewide in California is familiar with Telecare, and just all of the different types of behavioral health services that they offer. And so again, a well-known entity. And then finally with Marikey, we have a history of working with for the last about 7 years now, since we started intensive transition services with them. Marquee is the old NHS company out of, I think they're out of Pennsylvania or New Jersey, and they've been around quite some time, and they rebranded about 7 years ago or so, and we've opened some homes with them and have our intensive transition services. And so I think doing another crisis service with them is certainly important. Again, we will not be able to create residential settings for every individual that wants them. That is an impossibility. However, we can certainly put our times and efforts into creating services to help stabilize them, to keep them where they want to live. So if they want to live in their own apartment, if they want to live with their family, if they want to live, in a care home, wherever they want to live, we want to ensure that people have the supports to be able to thrive there. And so for us, being able to put some crisis services in instead of a relocation to a higher level of care is really preferential. And again, when we talk about keeping people in their community, we talk about keeping people with their family. That's why these things are big priorities for us as a regional center. And I really like it when we have our public meetings, because our community says the same thing. Our community wants local services. Our community wants a very robust service system, and especially for transition age. And so when we talk about these group homes for children with special health care needs, that's what we're going to be talking about. Historically, we've had the Bates small family homes that have dealt with a lot of the medical issues for our clients that are younger, but we have had a dearth. We have not had facilities that would be willing to take the older ones in our areas, especially. So again, very excited about this, local services, and kudos to our CPP team who are trying to push this through so quickly before the end. I think we're doing like a special board meeting like at the very end of this month to get all these contracts signed. So again, very good. Thank you very much. Budget stuff. I wanted to talk about budget things real quickly. There is the Democratic plan that did come out, and there's a few different things in it. So I'm going to go over kind of some general stuff, and then I know I'm going to throw it to Kelsey, because Kelsey's got a specific thing that is near and dear to her heart, and she's been doing a lot of work on recently, and so we want to talk about that as well. So this is, I will tell you, I'm going to give you the same update that our staff got today, which Lori did a good job of talking about some of the newer things that are in the budget, but they were not in the May revised. And so again, we're all looking towards the goal line here of the next couple of weeks to get the budget in place. What it has been included in the newest plan is modernizing regional center core staffing formula. So this was a big advocacy push for the regional centers, for the ARCA, for many of our service providers as well. Again, our staff salaries and how we are allocated positions through the state of California is based off of a very old accounting of what it costs to hire a service coordinator. I believe it is less than half of what it actually costs us to hire a service coordinator. So there has been a lot of advocacy on updating, modernizing the core staffing formula to key these service coordinator positions off of a similar state level job classification. And so again, looks like there is certainly some interest in this, and that one is hopefully moving forward. Eliminating family fees. This has been a big one for ARCA and advocacy as well, regional centers and advocacy, clients, family members. And so that is another one that is a little bit of an update. The acceleration of the rate increases. And so I have not read the specific language yet about that. Does anyone have a good summary about what it says, like right now, about the rate increases? What did they follow the Lanterman Coalition's request? Does anyone know this answer? It appears not. Well, then I think that they are looking at acceleration. It would accelerate the rate by 1 year. So instead of, I guess, being that full year of full implementation, it would move it up 1 more year. This action will ensure that DSPs benefit from the accelerated rate increases, and that individuals with developmental disabilities will have access to vital services. And let's see. Special needs dental clinics. I'm going to let Kelsey talk about that a little bit. This is something that was not in the May revise. Certainly there's been a big push about it, and we did a presentation, Kelsey did, during our board meeting about it. So take it away, Kelsey. And then are you able to share like in the chat the web links to the materials and stuff?
Yeah, so we just got a recent update. I shared, I think it was just last week or maybe the week before that that we advocated for a legislative budget ask of $50 million to build new and expand dental clinics and outpatient surgery centers for dental services for people with special care needs. And it has made its way onto the budget, so we're all very excited and happy to announce that. So the budget must be passed, as we all probably know, by June 15th, and the governor has until the 30th to sign it. So we've been asked by the California Dental Association to continue to push for the legislation and for Governor Newsom to include this proposal in the final budget. And I do have a sample tweet here that they provided us with that I will drop in the chat. To thank the legislative staff for the advocacy that they've done so far, and to continue to push for that ask to be on the budget. Did I cover it all pretty good, John? Is there anything else?
You covered it perfectly. Kelsey continues to blow me away with her understanding of all of this stuff and the way she's able to talk about it so clearly. We don't typically do this. We don't typically solicit you as service providers to like put things on your social media and stuff like that. Our executive director feels really strongly about wanting to support this dental ask. California Dental Association has been really in fantastic communication with a huge team of people, the ARC, ARCA, certainly us as a regional center representative because of some of the dental work that we've done. And so again, Kelsey's going to put it in the chat and would like the consideration that maybe you might share it on your social media if you do. The breakdown, I believe, Kelsey, is still that this would be individual grants that can be given out to companies, and those grants can be utilized to build these clinics, and the trade-off for the financing is that they would offer specialized dental care for the next 10 years, right? I think for
That's correct.
Yeah, for people with developmental disabilities.
Yeah, and
I think it's broader than just developmental disabilities, right? Though it's a
it is special healthcare needs. So not only will it help our clients, but also people with Alzheimer's or mental health issues, or our veterans, or other people with physical disabilities. So it is a wide range of individuals that would benefit from this. And they're thinking with the $50 million, they'd be able to do 10 clinics throughout the state. So we're pretty hopeful that that'll go through. I think that would make a big difference in the disparity that we're seeing of services.
Excellent. I apologize. I missed the things that popped up in the chat. We changed the meeting a little bit. You might notice we have interpreters as well now. And when we changed it, we don't have a few things that we had before. And one of them was that little beeping sound that was so annoying to people when people would be adding a meeting and leaving the meeting. Someone was smart, probably either the interpreters or Rima or Olivia Procida, that it would be kind of hard to do that interpreting with all that beeping sound that's constantly going on. So that's not part of it, and the chat thing doesn't pop up for me either. So that being said, I want to jump back over to the chat and go through some of the questions that are in there related to the rate study stuff. And then we'll jump back into the budget thing. So thank you very much for that, Kelsey. And can a provider actually see the calculations DDS, the regional center, used to calculate your rate and rate increase according to the rate study? I don't think that there would be any reason why we should not be able to be transparent with that. So what I would do is for the specific, that specific request, maybe we can workshop that request a little bit. Maybe we can figure out like what's the best way to share that information with our service providers. What's the best way to kind of look at the transparency related to that. So Jean, I would like it for that one if you could connect with Robin about it. So about the provider seeing the calculations that we used for the rating. Okay, thank you very much. And then we need to, let's see if maybe we can report back about that during our provider advisory committee, which is on Thursday. Is this Thursday coming up? I believe. Yeah.
Yeah, it's the 9th.
Okay.
Yeah. I can talk with Robin and maybe we can use that. We'll figure out how we can streamline that a little bit.
Yeah, absolutely.
Good.
And again, there should be not any questions or secrets that go on as far as how calculations were determined. We know that our staff put a lot of hours into it, and we certainly want to ensure that everything is accurate. All right. And we have, oh, sorry, from MedStar. In a previous coffee with Community Services, we were told that the current alternative services authorizations for transportation providers would be extended from June 30th to December 31st. Is this still true? The memo issued to 875 providers June 1st seems to imply that any consumer receiving transportation can no longer have an alternative services authorization. Please clarify. Thank you, Adam Ruggles. Very good. Good question. So yes, it is true that we continued authorizations through December 31st. And yes, it is true that if you're an 875 provider receiving transportation and you're just doing that transportation, that writer or the client might choose not to do alternative services with you anymore. So the alternative services authorizations may be continued and extended through December 31st, but every planning team will make a determination at what point services change. And so if there is a change by the planning team, then there's going to be a requirement to update those authorizations. So Gene, or actually I will shoot this over to case management if there's a case management that wants to jump in on this one. But again, that would be the expectation that we put up for our service coordinators, is that, you know, if the alternative services are just continuing the way they are, then, you know, we'll continue it through December 31st. However, each planning team then will make that determination whether or not, you know, individual clients are going to continue on with those authorizations. Let's see. Does that sound about right? If there's a case management supervisor that wants to give me a thumbs up on that seems like what we're telling people. Yeah. All right. I'll put my own thumb up. So, all right. Let's see here.
John,
Do you want to, and Gina, we are going to be doing a meeting with our transportation providers, you know, upcoming as well.
Right.
Because we do want to, there was a number of different questions that came up related to that.
We're just asking the planning teams to look at folks are returning to program on traditional services. We're just asking them to review the what the needs are and review the purchases. And we are going to have a follow-up meeting with the vendor, with the transportation vendors. Yes.
Thank you. So there's also some other things that have, let's see. And then we have the sample tweet right there. I am going to get back into alternative services a little bit more, because I had some discussion with some service coordinators about alternative services and their thoughts about their clients. And so I just want to get some feedback from you as service providers as well, and your thoughts. But in the meantime, though, I will jump back into some of the budget stuff. And again, we're waiting, you know, as Kelsey said, for finalization. The big thing though is we do want to encourage you to promote the California Dental Association's request, and we really do hope that one ends up in the final budget. Promoting workforce stability for regional center and DSPs. I know we're still not figured out how we're going to operationalize last year's DSP stuff quite yet, but now there's more of it that is going to be proposed in the budget as well, including looking at a tuition reimbursement program for service coordinators. That is something that popped up. I think it was there during the May revise, and I've heard numbers like $10,000 for like an educational stipend or something like that. So we'll see how that one gets finalized. Elimination of half-day billing. Modification of tailored day services. I think we've got Gary, and I don't know if maybe Carly and the thoughts, you know, we have so much of the tailored day services and the 80% rule, right? That was the idea before. Can anyone explain the 80% rule better than I can? Because I can't do it very well at all.
Yeah, so the 80% rule is pretty much it TDS services cannot cost more than 80% of the rate services.
So with the elimination of that,
Yeah.
then
So with
could
the so with the elimination of that, we can look at, utilizing more TDS hours. Because right now TDS hours are very limited. I think, each service provider is different with how many hours they have, but it's, average, maybe 35, 40 hours a month. So since that 80% is no longer, or will no longer be a rule, if it makes it into the final budget, then we'll have more flexibility. And another big change with TDS, one of the TDS rules is that currently it is in lieu of day program. And that is one big thing that is changing, is that it will be able to be used alongside another day program.
Thank you very much, Carly, for that. And any other specialists have anything to add? I think you heard a tinge of excitement in Carly's voice as she was talking about this, because it sounds like, and this sounds like more opportunities for folks. Is that what we're looking at? More opportunities? Okay, well, we can always use more opportunities, right? We want to go from scarcity to abundance, and we haven't quite got out of scarcity yet. So it would be great for us to be able to use some of these changes that are going to go on, legislatively, and really see that benefit to our clients. Let's see, some more information about early start eligibility enhancements and early childhood focus on transition from Part C to Part B. And this initiative would bring targeted funding to increase the number of service coordinators for early start ages 3 to 5, and they would have a 1 to 40 caseload. So that's some of the budget things that are kind of still going on along with all the other discussions. But a lot of folks were wondering, where was the core staffing formula? A lot of folks were wondering, at least I know I was wondering, where was the CDA stuff? Like, is the California Dental Association stuff going to make it in there? And then I think most importantly for you all is, what are, workforce wise, are they going to speed up the implementation of the rate study? So again, we will have all of these answers this month, and there will be a lot of kind of back and forth over the next couple of weeks, and would really appreciate your support, again, specifically related to the California Dental Association's ask for the $50 million for dental clinics and dental operatories. All right. So COVID tests. There has been yesterday there was information that was put out related to COVID for a number of Northern California counties, including Sacramento County, Yolo County. The public health officers from Sacramento and Yolo were on the news yesterday talking about the status of COVID increases within their area. As it relates to Sacramento County, there was certainly a rise in cases, but we have had a large, there's been a number of cases. What triggered the kind of warnings yesterday, to my understanding, are related to the impact on the hospitals and the local hospitals. Dr. Kasiri in her interview, indicated that right now we're not at any type of crisis situation as it relates to the local hospitals. So with that being said, there has been discussions about changes to mask mandates and things like that related to all of this. We will do our best to keep you all updated. I will say, it is tough to stay up on top of all of this stuff. It really truly is. And so I appreciate for some of you providers that work with residential settings or work in licensed settings like day programs. Community care licensing has been trying to do the best job possible in providing informational updates on what's going on with regulations, what are the expectations within licensed settings. And so I give a thanks to Scott, one of our specialists, who has been sitting in on the last few of those meetings and then getting us notes that we can send out to all of our staff so that we can, really kind of keep ourselves up to date as well. So I just want to encourage all of you as well, when, if you are a licensed facility, if you have the opportunity to sit in on those informational calls, sometimes there is very valuable information. I found the information that Scott was able to summarize valuable. So with just continued encouragement to participate in this. Meanwhile, we don't have any COVID tests. Obviously, you know, at the beginning, like January, February, we worked really, really hard trying to get as many tests to you all as possible. Sacramento County Public Health was so helpful in getting those out when we had our big surge and all of the testing requirements, and there was just no tests, and the labs were backed up. But that being said, we at the regional center we do not maintain a stock per se of tests. We tried to give out as many as we could, kind of as they were requested. Especially once we learned that community care licensing was no longer going to offer them to residential facilities. We try to get as many out to the residential facilities as we can. So with that being said, if there is someone that is in like a desperate need of COVID tests or whatever else, I do apologize. We do not have some on hand. We certainly can direct you to resources and places where you can try to get them, but the reality is operationalizing all of the things that are going on right now. I don't know that we have the ability to coordinate like large scale test like distribution to folks and things like that, like we did months and months ago. So just wanted to give that information out because I have been contacted by a couple vendors who are looking at purchasing tests and wanting to know what we have on hand because money's tight for everyone. And the Postal Service is giving out 8 free COVID home tests. I've heard from staff that have already put in for their requested tests. So I know that that is a reminder as well that we want to make sure that we utilize that generic resource. But you can burn through tests pretty quickly if you run, any type of program that has a lot of staff that are going to be interacting with clients. I would encourage you all yourselves. We haven't had major symptoms and things related to new COVID outbreaks, but we have had some folks that have had to be gone for a few days. And so just masking up, best precautions possible. We were just in the process of statewide opening up all of our meetings where like all of the ARCA groups get back together. So different regional centers all meet together. And unfortunately, it's a little tough because now we have some counties that are going to be a little bit more restrictive on some of these things. I think Sacramento School District talked about masking starting next week. So I guess my kids are starting summer on today, but I guess for some school districts in the town, they're still going. So so that's kind of what we're seeing with COVID right now. We're not under the requirement to do the COVID reporting like we were previously with DDS. All right, the DSP surveys. Has anyone, I would love this, in the chat, if you have filled out DDS's workforce data collection survey, can you give me a yes in the chat box right now? And that would be awesome. If you even know what it is, put a yes in the chat box. No, I'm just joking. I hope you know what it is because I think they have it attached to e-billing now. I'm going to share my screen so you guys can see DDS's website and understand kind of what I'm looking and talking about, which is the DDS workforce data collection. There is a survey and it is open until the end of June. One of the reasons why I wanted to know if anyone has done it yet, because I wanted people to chime in about how long it takes to fill out the survey, because I do not know that answer. So if anyone has done it and is on the call right now, but I also have a tracker right here that lets us know where we as a regional center sit with the rest of the state on the responses by our providers. And so we're not in last place, but we are in close to last place. And so we certainly want, there has been, I don't know how many times we've had discussions about workforce challenges related to U.S. service providers. And so, obviously we did our own survey last fall, which had some very, very devastating results as we looked at them. And then right after that, we got more vaccination mandates and booster mandates, which I think compounded a lot of the challenges that folks were facing, along with people just leaving in general. So that being said, we would like to ensure that all of our providers do this. Right now, let's see, what do we got? See if it'll tell me the number. If I hover over it, oh, there we go. Oh, 0.2% of our vendors 0.02 or 2%. Yeah, so a pretty low number there, 2% of our service providers. Again, this is the workforce survey. It's going to go through June 30th. There's a survey summary that discusses it. There is all kinds of materials on DDS's website. So just want to encourage everyone to fill that out. Any questions about DDS's workforce survey? I understand that there are folks that have complained about the timing of it because, you know, you guys are doing Hcbs stuff, rate review stuff, trying to run your businesses. Very challenging to have another thing to fill out. But just like anything else, if it's something that leads to, you know, enhanced funds related to service providers, I think it's certainly worthwhile. Have they sent a notice out yet? I haven't seen anything come through. I will double check and verify. There should have been, it should have gone out. I believe we sent it out already as from our regional center through our MailChimp server too, but I will double check that, Catherine, and make sure that you guys all have it. Because, yeah, I love DDS when they put the little dashboards up there so you can compare regional centers against each other on how many surveys we filled out. Good times. DSP surveys. All right, so you guys got that. The other thing I wanted to touch bases on, and I will share my screen again, and this was something that this might seem like a no-brainer to many of you, but it's something that our executive director and I were talking about, and it was just Cal Savers. One of the questions that we had was, is Cal Savers something that any of you as service providers are using with your staff? And so if you are using Cal Savers, and you certainly don't need to, you certainly do not need to start talking about it here in this meeting right now, but if you are using it, if you could shoot me an email, I think that would be helpful. So it's from 2016, it's been around 6 years. And so if someone is using Cal Savers, I want to learn a little bit more about it, how you're using it with your companies, if it's something that I should be and we should be promoting to other service providers. You know, benefits and things like that are one of those things that, you know, can make a difference on employees staying or leaving, looking at retirement and being able to have those discussions. Again, many of you are hiring very young folks that might not have, you know, that retirement on their mind type thing. But again, just wanting to get feedback from folks about what their thoughts are on Cal Savers and if anyone is using it. All right, let's see. Let's go transportation. Oh, Stephanie. All right. So Stephanie, if you could just like shoot me a little email and talk to and maybe we can like stay in touch as you sign up so that you can let me know kind of how it's working and things. Thank you very much. Because again, that's why we do these meetings, is that we want to be able to share resources with you all. But I certainly don't want to share a resource that someone, you know, says doesn't work well for you as service providers, or, you know, or there was some specific issue with your company trying to do it. So thank you very much for that feedback, and hopefully we can bring that information back to you as service providers in the future, something that you might want to be interested in. Okay, Hcbs validation and remediation. So Hcbs, home and community-based services. And this is the assessment. So I'm going to share my screen again so you guys can take a look. Cindy talked about this last week, Cindy Lay, and when Cindy discussed it, she indicated that the letter was going to be going out. We did send a letter out late Friday to everyone, letting them know about the materials. What we are working on right now is how we are going to have you all send the materials into us. We have about 300 service providers on our list. That's easily more than like 1,000 documents that would need to be attached and like sent to the regional center. And I would really like to have these specialists spending their time like answering rate questions and even questions about Hcbs validation and remediation. But they're not going to be able to do that if their mailboxes are all full with a bunch of huge attachments and documents. So We are working out a process so that we can have you guys gather it. I tried out the process. What we're looking at is doing something similar to what we've done in the past with the Sign Now application, Sign Now, where we would have you answer a few questions and then you could upload the different documents that are required. And so there was the letter again that went out by Cindy. We were hoping this week we'd have the process completely down, but it's gonna bleed into next week a little bit. We do need these materials turned back into the department. Excuse me, turned back into the regional center before the end of June. So we certainly want to give you as service providers opportunities to be able to get your documents in. On DDS's website, as you can see here, is the same attachments that were in the letter that was from Cindy. And additionally, we will be doing a training for our community services specialists, because our community services specialists need to still learn what to review specifically, as we have Cindy kind of help guide us through that. And then we put your uploads into DDS's final server. So again, related to all of these things, if you have a remediation plan, you're not sure what to do, there's training materials that are on here. The templates are on here. And we have a Hcbs specialist. That's her whole job, is to help guide folks through this process. And so again, just wanting to share with folks that those materials are on our website. And I am very pleased that we don't have to do all of them for all of you guys. DDS has a vendor that they are using, PCG, that is going to do a bunch of them, but then we again still have 300 different vendors that we are responsible for processing all of this for. So questions about Hcbs validation and remediation? The results of the, let's see, on the letter we received, the validation and remediation plan due dates are different. Yeah. So validation information has to be in by the end of June. And then we will find out if you get put on a remediation plan at that point or not. Because if your validation information is not done, then that means you self-assessed, but then we don't have any documents to like say, oh yeah, they're good to go. That's what this validation process is. The remediation plan is going to be due at a different date because some of you, if you indicated that you were on board and then now you don't have the validation documents, as I mentioned, you're going to get bumped over to the remediation list and you're going to have to develop that remediation plan. But we can't have that due on the same day. So DDS staggered it a little bit. So there's time to get the remediation plans. But what it means for these guys, like primarily the specialists that are here, is that they're going to be reviewing these things for like the next few months because there's going to be obviously so many that come in from all of our providers. And, you know, we really love everything to be like a beautiful PDF that comes in, but we suspect we're going to get pictures, cell phone pictures of pages of program designs or of monthly schedules or whatever documentation that you are all planning on submitting to do your Hcbs validation. Any word on the results of the virtual assessments done in the fall? You know, for the people that had the virtual site assessments, I thought that covered the validation aspect of it. And so, Joe, I think let's have you touch bases with, or shoot an email over to Cindy Lay, if you could, Joe, and then also CC me on it too, because Olivia's out. And then let's make sure that we have the correct answer specifically about whether or not those folks that went through the virtual site assessment are still required to submit a validation. I don't know if you guys are on the list or not. And I just want to express the same thing that I've expressed to other folks and specifically to our staff. There has been a lot of folks that have complained about the time frames, the fact that you guys did these self-assessments, over a year ago, that we're kind of condensing all of this into already a very busy summer where we are implementing rate study. DDS has their survey that they're putting out for DSPs as well. But again, you know, we are committed to doing our best to support you as service providers through these processes. And so let's see. So we submit validation stuff even if we assessed that we were compliant. Yes. If you assess that you are compliant, you now have to provide validation stuff to show us that you are, if that makes sense. And then we take that documentation, and then that's the documentation that goes to DDS. We had a virtual survey but received nothing, and I think that's the frustration for those people that had those virtual site visits. You know, there was nothing in writing indicating like good or bad. And so I guess the question would be, if you had a virtual site visit and you're only on the validation list, well, you may not be on the validation list at all. And so that's what we will verify. We will verify if you had a virtual site visit, whether or not you are on the validation list and whether or not you're going to require that. How do we know what list we are on? What we will do is we are going to discuss with Cindy Lay so that we have the release of the information kind of uniformly, because we do already have the list of folks that have validation remediation. I don't think we've actually sent them out to folks right now. So more about that, we will follow up. Thought we might have Cindy here, but I realized that she's every other Friday off, so she's not here as she was last week. So we can certainly welcome Cindy back next week, and we can jump on a bunch more of these questions as well. For alternative services, just one last thing I wanted to touch bases about that. You know, we had a residential vendor forum, and in the residential vendor forum, I talked a lot about alternative services and certainly the challenge that is faced by residential service providers when it comes to having to provide those additional supports for those people that are not participating in the in-person day programming. I have also heard from service coordinators that there's some clients that would not be participating in anything if it was not for alternative services. And so I think my takeaway in my discussion with that specific service coordinator was that looking at ways to build in the things that have worked really well through alternative services into ongoing day programming or ongoing, in essence, non-residential services. And so that being said, we certainly recognize the impact that it has on providers by having those alternative services and not being able to have those opportunities to go back in, 5 days a week to different services and programs. But then also we want to be sensitive to the fact that for many of our clients, this works for them too. And so trying to kind of figure out that balance. So I would just say, know that as we go over these next 6 months until alternative services allegedly are going to end, we'll be looking at ways of trying to preserve the best parts of the alternative services that we've had. All righty. So I told Gino Nessi that we'd be done about 11:20 today with our meeting. And so I think we might have gone a little bit past that time frame. I got my, my 10th COVID booster last night. And so was still feeling it a little bit this morning, but great talking to folks today. Hope everyone has a great weekend. We know that we're going to provide some updates on Hcbs. We're going to provide some additional budget updates next week as well for folks. So have a great weekend. We'll look forward to talking to folks next week, and we will have the recordings up on YouTube usually in about a week or two, I think, is where we're at for this meeting. All right. Take care, folks. Have a good one.